We're very privileged to have Dr. Ramani Durvasula with us, joining us from across the pond in Los Angeles. She's a professor of psychology at California State University in LA and a practicing clinical psychologist. The focus of her work has been on looking at narcissism and high conflict antagonistic personality styles and their effects on mental health and relationships. She has appeared on numerous media platforms, including TEDx, Bravo, and Red Table Talk, to name just a few, and has also published a number of books, including Don't You Know Who I Am? How to Stay Sane in an Era of Narcissism, Entitlement, and Incivility. The title of her presentation today will be Staying Sane, Healthy, and Authentic in the Era of COVID-19 and Beyond. So, hoping to have Dr. Ramani on any second now, and also the results of our poll. Hi there, Dr. Ramani. I'm sorry, you're on mute there. If you just unmute, please. There we go.
I think they're the bosses of muting me. So yes, good morning. It's good morning for me. So,
welcome. Thank you so much for joining us.
It's my pleasure. Thank you for having me. I'm very, very grateful for this.
Oh, thank you. And how are things in the States? It doesn't look great on the news. How are things?
It's pretty intense. I mean, I can see it's intense where you are too. You know, I'm in Los Angeles, and so certain areas of the country, California, New York, our big San Francisco, these areas have taken it a bit harder because they're more population dense. Not nearly as bad as New York we are, but we'll remain on a lockdown in Los Angeles until May 15th. And I work with patients. I have clients who are healthcare providers. So they're giving me some insights into what it's like in sort of the healthcare realm, that they're very, very overwhelmed, that, you know, that the hospitals definitely are feeling it. However, it does seem like we're seeing the top of this curve. You know, that it's now we're seeing some stabilization, and that word is coming consistently, both from the East Coast and from the West Coast. But it's a big country, and so there's lots of different experiences happening in the United States as well.
Of course, we can only hope it all improves for everyone.
Yes, yes.
We're still waiting for the results of the poll, but if you don't mind, we could just commence with your presentation. And if
absolutely.
You could, there we go, just as we speak.
There we are.
It's popped up on the screen. So we'd asked a number of questions. How would you want to do this, Dr. Ramani? Do you want to go through some of these results and then dive into?
Yeah, I would love to, because I mean, right now I'm looking at the results of this poll, and it's interesting that, I mean, obviously this is not scientific per se, but, you know, given that the most frequent response here was a rating of 7, you know, which is obviously over the average. And when we look at this, if I'm quickly doing my maths here correctly, 29, 30, 33, 35, you know, that it's kind of split down the middle, you know, that it's like a little bit, it's like half. Half are experiencing anxiety that's over, 5, so probably more than just average, and half are experiencing, you know, an anxiety that's at the lower level. So it's pretty evenly distributed. And then in terms of coping with the pandemic, now it's interesting because many people feel that they're coping quite well. And that's really reassuring to see in this group. And then in terms of people, and this is very interesting, is that people, in terms of their optimism post-pandemic, that we have well over half, 72% of people are saying either they feel more optimistic or about the same, but, you know, only 28% are saying that they feel less optimistic. And in terms of the greatest fear raised for people about the pandemic, it all falls under the realm of other. So if there is an opportunity for questions, it might be interesting to hear what that other is, because other than that, the biggest issue that's being raised are financial issues. And so, I mean, what we're seeing, and whomever is comprising this audience today, is that anxiety seems like it's not overwhelming, and there's actually some good positive feelings for what may come after this, that this doesn't seem like the end of the world. And that makes me really happy to hear that. So that's good. Yeah.
Yes, I'm sure we'll get a lot of questions. Over to you now for your presentation. Thank you.
Yeah, so I'm going to do my presentation and definitely make sure, because I know it's the end of the day, that there's plenty of time for questions. So I will, you know, what I'm going to do is some ideas and questions were sent to me from the original email from your group. And so I'm going to try to visit those and then bring it into questions. You know, one of the issues that had come up when your group had reached out and said, basically, overall, what are the mental health issues raised by this pandemic? I have to tell you, as a mental health practitioner, we sort of train for everything, and I've been doing this for a long time. I've been in the mental health world for well over 20 years, and nothing could have prepared us for this, because even other events that have happened in the world, they're often localized. Like if there's a big hurricane or a big earthquake, we feel very sad for the people who are suffering, but most of us are not there. This is the only time in my lifetime I've watched an event that has pretty uniformly affected everyone in the world, and our movements and our jobs and all of that. And so watching that happen and then having it have the effect in terms of our day-to-day lives. So it's not even like an intellectual exercise. Everybody's like, wow, I can't, I'm not going to my office. I no longer have my job. My children are home from school. This is affecting people's day-to-day lives. So that's really, really notable. So when we look at the mental health impacts of what's happening here, it's a whole range of issues. And the ones that seem the most, the most central are everything circling around anxiety and stress. And I'm hoping you can hear me okay, yeah? It's okay?
Oh, sorry, just to interrupt. So sorry, Doctor. I think there's some tapping happening on your headphone.
Oh, on my microphone. Okay, so let me lift that, and that might do better. Okay.
It might be the earrings that are tapping against.
Well, then we'll take off the accessories. How about that? There we go. Is that better?
Thank you so much.
Yeah, okay. I wanted to make sure you could hear me because his image was frozen, so I would have felt bad that I was talking on and no one could hear me.
No,
so,
and if you have any slides as well, please do share your screen.
Yeah, I didn't have slides, and then I make them last night, and I thought by the time I got them to, it'd be too late. So I actually am working without slides. So
No
just so you know that. Yeah. Okay.
Thank you.
So yeah, absolutely. So the prime issue we're seeing, our prime issues we're seeing are anxiety and stress, and everything is sort of coming down off of that. The anxiety can cause a lot of sort of symptoms in our day-to-day life, impact things like our sleep, our appetite, our ability to concentrate, the kinds of thoughts we have. People can get caught in really sort of negative thought cascades. And these are things like, nothing's ever going to work out. I'm never going to finish my degree at school. My career is never going to come back. A lot of talking in extremes and catastrophic terms. That's what anxiety does. In many ways, when anxiety does sort of take over the brain, it also takes over our language. And so as a result, we start talking about things like, it's never going to get better. It's always going to be bad. And that language, how we think about it, affects then also how we feel about it. And then we feel worse, and when we talk about it worse. So it becomes a very reciprocal back and forth. We also know that stress, and as we're experiencing it now, everybody is experiencing some stress. It is interesting. I maybe have worked with a handful of clients in the last few weeks, have sort of looked at me with a look of guilt on their face saying, my life is now a little bit easier. I am working from home. I'm fortunate to keep my job. I don't have to commute. I'm a little bit introverted, so I don't mind being on my own. That's a pretty rare response. For most people, the uncertainty, the different demands that people have, the loss of a routine, all of those things, the unpredictability have all caused an extreme level of stress for people. And the issue with stress is what it does to the brain. I think that we think, oh, I'm stressed, I can't pay the bill, or I don't want to study for my test, or I'm dealing with my, issues in my marriage, or whatever it is. It's not just that sort of experience or the inconvenience of stress. It's also what it does, not only to our mind, but to our bodies. And what stress does is it slowly takes over our brain in a way that, for example, we start over-interpreting everything as a threat. And so we definitely start feeling more and more on edge. And in addition, we are more likely to feel sort of a sympathetic nervous system bang. Many of you might know it as fight, flight, or freeze. That when our autonomic and our sympathetic nervous systems get turned on, as they are for many people right now because of the stress and all of that, you're very, very on edge. That might manifest as you being more irritable, having more difficulty making decisions, feeling physically more uncomfortable, having headaches, muscle tension. And one of the bigger problems is under that level of stress, your immune function also isn't as good. And so here we are all trying to sort of stay healthy in the face of a virus. That's actually not really a good scene. The other kinds of thinking issues we're going to see is lots of worry. And the worry's not just about what's happening in the pandemic at large, but it's everything in our lives. I am actually very struck by the number of people who are getting caught in absolutely unrealistic demands for their life. So meaning that I was talking with someone, and now they have to take care of their kids at home and do their schooling at home. And this woman was exhausted when I was talking with her. And she said, I'm only getting 1 hour of sleep at night. And I said, why are you only getting 1 hour? That's terrible. And she had a pre-existing health condition. She said, I have to get up. I have to set my children's curriculum. I have to have all the bulletin boards up, and I have to set up all these art stations in my house. And I looked at her, I said, why do you need to do all of this? And what had happened was her expectations had become so unrealistic. She was creating more stress. It was as though her decision-making was off. Honestly, her kids just would have been fine with her making sure they did their reading for school, drawing a picture with them, whatever it was they needed from her, and mostly her companionship. They're lonely for their friends. But what is happening is there's this sort of inefficiency and this sort of self-punitive, I have to be productive, I have to do this. And people are almost like they're sort of spinning under the stress and misallocating their resources in many ways. We are also seeing that people are struggling with symptoms of depression. And symptoms of depression can manifest as not just sadness, but also something we call, it's got a fancy name of anhedonia. And anhedonia is a very fancy way of saying you don't get pleasure out of things that typically give you pleasure. And that might be whether it's reading or watching a television show or taking a walk. You just don't feel like doing anything, and that translates into apathy, just not feeling motivated or really caring to do anything. And beyond that, people who are depressed may also present as quite irritable. And that's actually not an unusual presentation of depression in men. And that gets coupled with things like difficulties with sleep, changes in appetite, challenges with concentration and attention, negative thoughts about yourself, feeling worthless, feeling guilty, and in the most extreme, thoughts of suicide or harm to oneself. And what a lot of people are saying, oh, we're in the middle of a pandemic. If I'm depressed, there's nothing I can do. And there absolutely is something you can do. My clinical practice is as full as it's ever been. I worked 12 hours yesterday seeing clients. We're all working. And I'm sure that that's true in the UK. Everyone is continuing to provide mental health services now, in fact, more than ever. So if somebody's feeling the onset of those depressive symptoms under the amount of stress we're all under right now, that's not surprising. And this is very much the right time to seek therapy through telehealth services. The other mental health struggle we're also seeing is loneliness and isolation. Being alone and being lonely aren't the same thing. Some people are better at it. Some people like being alone just from their personality style. It's okay for them. They do better with it. But some people are feeling really, really isolated. They may have workplaces where in general they were really surrounded by people, colleagues, staff, clients, whomever that they really enjoyed being with. You also may be isolated from your family. For example, my parents live on the East Coast of the United States, so I can't even see them during this. And that's a real sense of isolation from them. And so that sense of loneliness and isolation can really, really be putting people on edge and also leaving people feeling like, this is odd, I can FaceTime with them. I mean, listen, this is lovely, but I'd much rather be standing in a room with all of you than talking to a screen. And then there are the sort of that trifecta, as I call it, of powerlessness, helplessness, and hopelessness. And those issues, powerlessness, helplessness, and hopelessness, often for many people sort of sap them of their will to keep going on. Like, why bother? Why should I try doing anything? This virus keeps going. I no longer have my job. I don't know if I can go back to school, and on and on and on. These are feelings that almost make us feel defeated. And we're going to talk a little bit about how we can handle some of those things. What we have to remember is that when the pandemic happened, it didn't just create all kinds of new problems. Many people were already living with mental health issues, with chronic anxiety, with mood disorders such as depression, with issues around eating disorders, with substance use disorders, all of that. We know that stress exacerbates mental health issues. We also know that one of the best interventions we have for people who are living with mental illness or struggling with mental health issues is to have predictability and routine. Well, we just lost all of that in the last few weeks. So anybody with these existing issues, it's gotten a lot worse. And people now are more apt to turn to more maladaptive tools like drugs and alcohol, like overeating, like having a sedentary lifestyle as ways of coping, which are definitely not good. And so we're seeing, again, that sort of exacerbation. Another piece I don't want us to forget about is the issue of grief. The word grief is often saved for when we think about death, the grief following someone dying. We don't think of grief as often as being a universal part of loss. And loss can be anything from losing a job, losing an opportunity to keep going to school or finish a degree, even losing an important rite of passage. For many, many students, we're coming into a time of graduations. They worked hard for 4 years, 6 years, however long they worked. And we're so looking forward to a celebration, right? With the cap and the gown and the family. And that's real. That's a real loss. And many people are saying, oh, I shouldn't be making a fuss over this. People are dying of a virus and I'm just upset I don't have a graduation. It's real. And I say to them, that grief, you must allow yourself it. So all of us, I can't think of anyone who hasn't lost something. For some people, those losses are smaller. For some people, obviously, they're monumental. They're losing family members. But everybody is going through a collective grief and a collective loss. And we need to create safe spaces for people to be able to grieve. And the final thing I want to speak about, and this is something that's coming out from global literature. Some of the first data and published reports came out of China, and we've now since seen these numbers reproduce all over the world, is the uptick, the increase in domestic violence in the face of the pandemic. People being closed in family violence situations, that's never going to end well, and it's exactly what we're expecting. The volatility being induced by the unpredictability, the financial instability, all the things that are happening, not to mention the existing issues in that relationship, have now created these situations where violence in these relationships is now going up. There's fewer places for men and women who are the victims of this violence to turn. A lot of, I was actually have on my YouTube channel, I had an interview with somebody who's a domestic violence coordinator and practitioner here in Los Angeles. And she said, we're open for business. We're as busy as ever. But part of the challenges are finding places for people to go to keep them safe. Those things were often easier prior to the pandemic, but the services are there. And I think a lot of people living with mental health issues, living with domestic violence, living with substance abuse issues are feeling like, well, the world is shut down, so there's no help for me. There absolutely is. Everything's open. It may be through these screens, but all of us are open. The programs are open. And if a person needs a safe place to go, those things are there. Emergency services are still being given, but this is yet one more tragic mental health consequence of this pandemic. Another question that came up in the materials that I got when I was asked to speak today was, what is the research showing on the mental health impacts of social distancing and isolation? As you can imagine, those mental health impacts are very similar to what we're seeing as the overall mental health impacts of the pandemic at large. We're seeing, obviously, most compelling are things like fear and anxiety. And a lot of that is because not only are we worried about ourselves and our own futures and our own health, what more people are worrying about far more than ourselves is each other. People worried about their children, and even in a more pronounced way, worried about older family members. And it's how do we talk to them? How do we keep them safe? And that puts us on edge. And also, if we're around people who aren't following the recommendations, we want to get frustrated. We're getting frustrated. We're like, I need to isolate from you. So it's bringing up a lot of confusion. But more than anything, social distancing and physical distancing are really raising a lot of issues around fear, around anxiety, worry for other people. There's a lot of, again, we talked about depression, but here's another stressor, and we don't even always think of this as a stressor, and that is boredom. That people are bored. I have 2 adolescent daughters, and all they talk about is they're bored, and I'm like, oh, there's many things to do, but for an adolescent, they want their time with their friends, and frankly, I never thought these words would come out of my 16-year-old daughter's life. She said, if I could just go back to school, I'd even wake up at 4 a.m. and leave on time. And I just started chuckling to myself because getting her out the door was never easy. And it's interesting. They're bored. A lot of people are bored, but I think that's very pronounced in certain age groups. And a lot of this is also the loss of routine. Even if you didn't love your routine, it was your routine. Also the research is suggesting that under conditions of distancing and isolation, people are feeling very angry and they're feeling very irritable. Now, not only does that relate to more extreme situations, like I was talking about with, for example, domestic violence, it's just a general sense of frustration. And there may be more interpersonal tension, even when you're talking to people remotely, let alone with people in your home. And then a final piece is around stigma. Stigmatization is creating an isolation that is, to me, another mental health crisis. We saw this early on with the stigmatization of people who were of Asian, particularly Chinese descent. And we were actually seeing incidents of violence and hate towards individuals who simply just by the, were Chinese, are Chinese in appearance, and were facing ethnic slurs and violence. This has now extended to other groups. A client of mine who's a healthcare practitioner said, we're terrified to go maybe into the gas station or the store on our way home in our scrubs, even if our scrubs are covered up, because people are viewing healthcare providers as vectors of infection. And while everybody may be clapping for the NHS and healthcare practitioners and their parades and everything, there's also a growing hostility towards people who are viewed as potential vectors of infection. And unfortunately, everyone's always behaving well. And that sense of stigmatization can create a sort of internal sense of isolation. I'm scared to go out in the world. People are scared of me. And I've actually seen that to be an interesting intersection for people who may not only have the sort of the racial or the phenotypic characteristics. For example, they're Chinese American or Asian American, and they're a healthcare provider. So now they're even facing, it was almost like an intersectional stigmatization. And I think again, although the news is like, oh, the healthcare workers are our heroes, a lot of them are really facing a lot of stigma. So I think we want to be aware of that, and in terms of how it's communicated, because I can double down on that sense of isolation. The other question, and I wrote all these down to be very organized, to make sure I got to all the things that I was asked to speak about, so then I can switch to switch questions, is that one of the questions I'd gotten is sort of the strange behavior, some of the consumer behavior people are engaging in the face of this. And one person asked me, are we going to have more OCD as a result of this? We want to be very careful with the use of some of this diagnostic terminology. OCD stands for obsessive compulsive disorder. Now, for people who were living with obsessive compulsive disorder, an obsessive compulsive disorder is a pattern whereby a person typically experiences obsessive, intrusive, and unwanted thoughts. And in order to offset those thoughts, have to engage in a compulsive behavior. The most classical example is a person who's very, very afraid of germs and then gets into a very time-consuming ritual of having to wash their hands 100 times or for an hour before they leave the house, making them very inefficient, could actually cause a lot of harm to their skin. And it's also, it's upsetting for them because they can't get out of the house without doing it. Now, us washing our hands 20 times a day doesn't mean we have OCD. It merely means we're following these recommendations. But for people who had existing OCD, this could cause an uptick in symptomatology, if for no other reason but the stress. Some of the other behaviors, like people buying too many things, buying too much toilet paper, too much food, people are saying, is that hoarding? No, it's not. I think that what happens is, and what we're seeing is, under conditions of significant stress and perceived scarcity, there's not going to be enough toilet paper, not going to be enough rice or something like that, people's decision-making capacities plummet. And under those conditions of perceived scarcity and stress, we often have an experience of decreased psychological bandwidth. And when our bandwidth decreases, we make decisions that are very momentary. I need to buy 500 rolls of toilet paper. I'm thinking you're going to be using the restroom a lot to get through all that, and someone else isn't going to get it. But that bigger thinking, if I buy too much toilet paper, someone else won't get it, is not what happens when our bandwidth narrows so much. So some of this behavior, hoarding is a little different. Hoarding is usually a longer term behavior when people just keep accumulating and accumulating things that are unnecessary often. And if you try to take them away, it causes them a lot of distress. And it's often done over so much time that their physical environment gets crowded in. Now, hoarding is also a decision-making deficit, but some of the consumer behavior we're seeing, purchasing too much food, purchasing too many things like toilet paper, are much more likely to be a manifestation of the massive stress, the perceived scarcity, and the decision-making deficits that come in the sort of in the face of that. And all of that relates to that earlier stuff I was saying about stress and the activation of our sympathetic and our autonomic nervous systems. So then the bigger question becomes, how do we manage all of this? What are we supposed to do? And I'm going to give you a few very simple kinds of strategies, some of which will work for you, some of which may not, but hopefully some of this things will. And the other thing I've done is I've provided to the conference organizers, I have been steadily accumulating resources since the beginning of the pandemic and been very careful to curate the resources that I think are reflect best practices and the best evidence base. So those resources I'm going to make available. And the great thing about those resources is a lot of them have embedded links, and they go to really nice apps and lists and activities and things you can do. So it's all very actionable. But if we break it down, I would love to start as we think about managing stress and anxiety from the position of self-compassion. Kristen Neff is the person who has really done a lot of this work on self-compassion. She's done some wonderful TED Talks and all of that. But she views self-compassion as being made up of three elements: self-kindness, common humanity, and mindfulness. Never before have we needed self-kindness more. We are all far more mean to ourselves than we are to anybody else. In fact, if we ever treated other people the way we treated ourselves, we'd be ashamed of ourselves. And we desperately need self-kindness now. So many people feel like, again, I'm not being productive enough. I'm like, what are you talking about productive? Like the fact that you got out of bed, I'm proud of myself. I did this webinar. I'm going to kind of quietly do the other things I need today. The fact that you might have kept your children sane or colored a picture with them or answered some of your emails or folded the laundry, like we've got to be kinder with ourselves. We're sort of building this airplane in the sky and figuring it out as it goes. So we often judge ourselves more harshly than others. We need to judge ourselves in the same way we think about other people, and we're often quite kind to other people. The other is this concept of common humanity. And this concept of common humanity has never applied more. We really all are in this together. We really are connected by being human beings now. We're all vulnerable. We all need each other's help. And in fact, those of you who said you feel more optimistic about the future, I'm not an optimistic person by nature, and I kind of do. I think it's absolutely beautiful that I get to talk to people in London this morning, and I think that there's such an amazing connection that could end up happening, that we realize that the only way this was going to work is if we kept each other safe. And so it's my hope, and maybe I'm a fool and I know enough about narcissism to know that may not work out, but I do think that common humanity is a big part of self-compassion and seeing that in each other. And finally, and most importantly, mindfulness. This pandemic has become the greatest masterclass in mindfulness that we will ever get in our lifetimes. We are so focused on, I got to do the next thing, and I got to drive here, and I got to answer this text, and I got to do, and I got to plan for the future, and I've got to save for my retirement, future. What we are not good at is this moment and the things that happen in this moment. I think many times in a religious space is often where people get their closest to mindfulness, when they're engaged in prayer or meditation, that they're best able to breathe and stay in that moment. But we can make mindfulness experiences happen. We got no choice. Our lives now look nothing like our past. We have no idea what the future is going to look like. So using our current moments, reflecting on the current moment, because that's really all we've got that's real. And that can be done through many ways. It can be done through meditation. It can be done through brief 5-minute mindfulness exercises where we can focus on our 5 senses. I actually do mindfulness stuff every time I wash my hands. I wash my hands like 20 times a day, but I get the water to a temperature I like. I use a soap that I happen to like the smell, and just that sensation of like the 20 seconds, paying attention to the temperature of the water, the sensation of the suds in my hand, my fingers against each other, the smell of the soap. It is a little thing that kind of brings me back into the moment, even when my thoughts may be racing at other times. So that mindfulness piece is also an important part of self-compassion, and it connects us back to ourselves. The other issues I bring up for people is, above all else, we need routines. Every one of us needs some kind of routine, and it doesn't look like our old one. It used to be, I'm going to grab my coffee and jump into my car and go to the coffee shop and that's done. You had a routine before. Now you need a new one, and you can have one at home. It may be the way you make your tea in the morning. It may be, I'm going to make my tea and read the news, or I'm going to take a walk. Give yourself a routine, and the morning routine might matter more because it gives you a benchmark to go from. Don't make the routine unrealistic because of the conditions of the world now. You can't get things done in the same way. Give yourself maybe a couple of things that you hope to get done that day. Be kind to yourself, mix those things up, but create something that resembles a routine and try to build into that routine things that are good for you, like some form of movement, whether that's inside or outside of your house. Turn off the news for a little while. People are getting these notifications on their phone and their social media, and it's constant. You know, a physician said something very interesting the other day, and she had said how this is a unique time in that physicians, researchers, infectious disease specialists, epidemiologists all over the world are working on this at the same time. And the rapid dissemination of information means you've got the best brains on the planet working on this. And the healthcare professionals and the clinicians are learning something new every day on how to treat this, how to manage it, how it's transmitted. Because we're learning more every day, we're getting it better and better. So in only 4 months, look at how much we've learned. And there's optimism in that. But there's also this sense that we're also overwhelmed. Do I wear a mask? Do I not wear a mask? Do I go here? Every day the rules are changing. We do need to tune in to know the rules, but we need to turn it off, because it's like, if I have to read one more like human interest story, and then I feel guilty, and I'm like, you know what? I need to just go read things that are good for me, my clients, my family, that sort of thing. So turn off the news. Connect with other people, whatever that looks like. It could be a scheduled Zoom call with a friend. It could be a FaceTime session with your family. I'm actually talking to my family now more than I did before this. It could be playing board games. Whatever it is, find that way to connect with other people. It matters more than we think. And afterwards, we often tend to feel a little tense. Build that into those routines you have. Look at your life as 2 circles. All the things you can control and the things you can't control. And focus only on the things you can control. You can't control the government's response to this. You can't control when the lockdown is done. You can't control how much personal protective equipment is out there. You can't fix that. Now, what you can do is, if you see, there's a group we can sew masks and donate them, you can control that. And so you can contribute to the things you feel like you can't control. But spending too much time saying, I need to know when this is going to be over, you have no say over that. But what you can control is you can control things like following the recommendations, keeping a routine, all of those things. So you can control those things. You can challenge your negative thoughts. You can create distractions. And the last point I'm going to make before we switch over to questions is you can also, and I think this is a wake-up call for everyone, many times all of us are living on a treadmill, trying to make our goals and get through our check marks and do this and do that. And we never really equate this with our larger meaning and purpose. This is a time for all of us to sit down, take a good hard look at ourselves and our lives and say, who am I? What am I about? What do I stand for? Because if we, after this pandemic, because it's going to be over, and there's a big old future there, if we can start living in line, living in connection with our deeper meaning and purpose, even the most mundane of the tasks we do are going to get elevated, and we will live in a better space of mental health, not only during the pandemic, but beyond. So I want to open this up to questions, because I know it's running late, and I know you're all later in the day. I'm just starting mine, but you guys are later in the day. So I'm not sure of the best way to handle the questions here, because I've been seeing some of them come up. Is there a way for me to go back and see those?
Thank you so much for that fantastic presentation. The messages were superb, and we have quite a few questions.
Great.
I just collated some of them just so that we don't
Thank
double
you.
up on them. So one of the first ones we have is from Zishana, who's talking about how we can elevate negative thoughts, especially whilst we're in this kind of self-isolation and this pandemic time.
It's a great question. Those negative thoughts are such a byproduct, so much of the anxiety and the stress. The one thing I would suggest most strongly, and I call, you know how like people do resistance training to build their muscles, like they keep, pulling things in opposite directions. I want you to do resistance training for your mind. When you have one of those negative thoughts, intentionally, even if it doesn't feel right or real, I want you to come up with an alternative to that negative thought. Like, I'm going to make up one. I'm never going to meet this deadline. I'm never going to get this paper written I need to get written for work. An alternative thought to is, I'm going to get this paper written, but it's going to take longer to publish, or I am going to get this paper written. Coming up with that sort of alternative thought each time is actually really a step one. And for a lot of people, they roll their eyes like, oh, I don't believe the alternative thought. I say, I know you don't believe the alternative thought, but simply articulating it becomes very, very important. The other thing I want people to pay attention to is how they're catastrophizing and how they're what-ifing. And by what-ifing, I mean, what if my school doesn't open? What if the lockdown doesn't end soon enough? What if my sister's wedding gets canceled? What if? We don't know. And again, it goes back to that mindfulness piece. We don't know. And as of now, we've already endured so many disappointments from what's happened, and we're fine. How many of us have at least one important thing canceled or gone away from us? And at the time, that felt catastrophic, and it's come and it's gone, and we've been fine. So it's really, again, staying in that moment and saying, yep, no, I'm going to be okay. I'm very fine. And then finally, another piece I would say is connect. Pay attention to how you connect, I should say, those emotions and thoughts. Some people out there are feeling like, I'm so anxious. I feel it in my chest. If I feel this anxious, something must be terribly wrong. I want people to separate that out a little bit. Yes, you do feel anxious and scared. Maybe it's because there's so much negative information out there. And just because you feel all that doesn't necessarily mean something is wrong or something terrible is going to happen. But really, I want you to think about this as emotional resistance training. Come up, challenge those negative thoughts. And when you can, distract. One thing I'm going to say to everyone, and this is sort of a little bit cutesy, but I'm going to say it anyhow, make yourself a little distraction jar. Take a bunch of index cards, write 20 things on these cards that are good distractions, watch something on Netflix, take a walk, clean your closet, whatever, and put them in that jar. And when you feel those negative thoughts, go to that jar, pull one of those cards out and just say, to heck with it. I'm going to organize my socks drawer, and go do that. Because those moments of distraction become reboots, and we reboot for a moment, and then that negative thought may not have as much importance.
Thank you. That's some really good tips there for us all. There's a few questions that have come, which I'm just going to pull together, which are to do with how we manage with our families or flatmates, whatever it might be, when we're living with them, particularly when they are, let's say, displaying toxic behaviors, or let's say they're acting differently, or maybe just not coping well with the pandemic. And we don't really realize that they aren't coping well, but they are affecting the relationships and are quite destructive.
It's a brilliant question. And as you can imagine, because of my work on narcissism and toxic relationships, that's most of the work I've been doing in the last few weeks. So it's a great question. I'm always going to say this. Most of us have become less graceful as this has happened. I mean, let's face it, no one is at their best under stress and pressure. And if you have somebody who's got a more difficult, antagonistic, or conflictual personality style, it's going to be much, much more significantly worse. So I'm going to give a few guidelines. Number one, have realistic expectations of this person. You know what they're about, and you're like, oh, I know they can be difficult, and now they're being really difficult. This was probably not going to be their moment of grace. So you kind of know it's coming, and you're prepared. Number two, don't personalize their behavior and their words. Because when you personalize it, in essence, what's happening is they're likely having the same or even more anxiety as other people. But instead of regulating it internally themselves, they take it out on other people. This is going to be a gross example, but I'm sorry, bear with me. This would be like somebody who ate something that's not agreeing with them, and they proceeded to throw up on everyone in the house. Like, they literally just threw up on everyone. Like, what are you doing? This is awful. You should have gone to the bathroom. I'm asking them to do the same thing psychologically. They should they should regulate more quietly instead of letting it out on everyone. But that's what they do, leaving all of us to clean up the mess. But the fact of the matter is that what you can do is not personalize it. This is often not targeted as you. So when they're going on and whinging and all of that, you can really say to yourself, I can step back from this. This isn't about me. It's actually not a really good time to engage them. If this is someone you know to be a difficult or toxic personality, you know darn well every time you've engaged this person, it doesn't go well. When you try to explain yourself or defend yourself, they attack even more. And now it's turned into something really awful. Their complaining and everything else is really their manifestation of anxiety. Now, that doesn't mean everyone struggling with this needs to turn into some sort of human punching bag, but it is to give yourself permission. Do not feel like you have to fix it. You cannot solve their frustration. You cannot take away their anxiety. You cannot snap your fingers and end the shutdown. So that's where that powerlessness feeling comes from. But if you can recognize it's not your job to solve this, and give yourself the space, if anything, if there's a place to go, go. If you're allowed to take a walk in your neighborhood, take one. If it's late at night, obviously you can't do that. But at some level, I call this concept soul distancing. It's social distancing, physical distancing, forget that. I'm talking about soul distancing. I could be sitting this close to you as you and I are right now, literally, not literally, but having your face near me. But I could pull back that part of my soul, and you could be yelling at me, and I could just sort of be looking almost right through you and nodding and saying, I see, okay. But my soul has been pulled out of this one. Like, I've safeguarded it inside of myself. So I'm not taking that, And if you're very intentional about that, almost meditative, like, my soul is away, I'm not gonna let them get to me. And it becomes a mindfulness. You can even pay attention to your breath. Then at some point they're gonna get bored because you're not fighting with them. And then you can go off to sleep and then you're good. But that's how I would use soul distancing. It's a very useful tool.
Fantastic, fantastic. I think that resonates with a lot of our spiritual tradition, actually.
Yes.
That's very, very interesting for our viewers.
Mm-hmm.
We actually have a question now from one of our speakers, in fact, the medical specialist that we had. She's a family doctor, Dr. Azmi, and she's asked, what advice can you give family doctors for how to support patients who've experienced bereavement due to COVID-19? Especially with issues such as isolation, preventing them seeing their loved ones or attending funerals?
Yes, this is a fantastic question and such an important one. Here is where, especially because so much of mourning and grief is tied into tradition. The reason we have grief and mourning rituals and funereal traditions is because they help us process loss. And so now, not only are people processing loss, they've lost their funereal traditions. And so it's almost as though without those benchmarks, they don't know how to experience loss. I think as a family medicine physician is to let the clients know that it is normal, that you're going to have a range of reactions. And there are going to be days that you're in denial. There are going to be days you're very angry. You're going to feel robbed of your ritual. You're going to feel robbed of your loved one. There are going to be days when you feel guilty that you lived. And to give them that space, that this is going to go on for a while. I actually think that in the face of the pandemic and people who lost people to coronavirus and under these circumstances where they couldn't even say goodbye in person, we're going to be seeing more complicated bereavement. People who said, if only I had said goodbye, if only I'd had that last day, there were things I wanted to tell them, but I couldn't. That people are going to be going through more complex grief, that it is not unusual at this time to need to talk to a mental health professional or be in a group that specifically manages grief. Ideally, a group that also understands the traditions of mourning, and that I think that for healthcare providers, at the same time for her, I'd also want to say to her and her colleagues, they themselves are going through a grief and a helplessness too, because they are having to be the enforcers of these rules. No, you can't come in and see your family. You have to say goodbye like this, where sometimes cases, some physicians in the States are calling people by phone and telling, it's never how it's done, right? They're telling them usually in person, that can't be done now. And so I think it's to prepare them to say, you're going to have a range of reactions. That's okay. Be gentle with yourself. Grief is a time. It's almost like if we had a physical illness, we would give ourselves the time and space. Grief is just that, to give themselves the time and space to use whatever social connection they can have, whether it's virtual or otherwise, to grieve with each other, to understand that this is going to be a complicated space. And I would also say from a spiritual perspective, to work with the spiritual leaders, whether that's an imam or whomever they're working with, to find out, are there other ways to process this grief in the absence of our usual funerals? Many people may actually feel a sense of guilt that I haven't done right by them because I can't do the steps that need to be done. And I think turning to spiritual leaders to get some guidance on how to think about that, that's also going to become an important space. But more than anything, regardless of what your traditions are or how you're coming at this, give yourself the time and space. And for the frontline providers, they are going through grief on a daily basis, feeling like they can't support their patients the way they want, and to build in some time and space for themselves to do that too, or they're going to exhaust themselves.
Absolutely, absolutely. We need to look after our NHS staff as much as
Oh,
as well.
yes, yes, all of our healthcare providers.
We have a very interesting question here from Rassi, who's mentioned about denial, people who are in denial with COVID-19. And I think what they're meaning is to do with, we see a phenomenon where some people are going to supermarkets and, licking foods, or, they're acting in very odd ways. And it does almost feel like there's this sense of, this is not a big deal. And is there an element of self-denial, or is it much deeper than that?
I'm going to be a cynic. I'm going to be frank with you, because I actually wrote a blog about this, and I'll actually try to share it with your group so you have a copy of it. Listen, when you have a hammer, everything's a nail. When you study narcissism, that's how you see these things. But I have to say that there's a lot of people out there who are enduring this pattern where people are saying to them, oh, you're being ridiculous. This isn't that big a deal. You're being foolish. I'm going to go out. I don't care if I wash my hands. I'm going to do what I want. And they're almost gaslighting or denying the reality of the people around them, which is very abusive and very offensive. And there's an arrogance and an entitlement. These rules don't apply to me. I can do whatever I want. The government can't tell me what to do. This is all a conspiracy. I mean, really sort of fringe stuff. But it's very antagonistic for the rest of us who know this is very real. Yes, we're being inconvenienced, but we're being inconvenienced for the greater good. They don't see it that way. And so I don't know how much of it is a denial as much as an oppositionality, like a very spoiled child or a very rebellious adolescent saying, I'm not going to follow the curfew. I'm going to come home at midnight kind of thing. And that's what they're doing. And the problem is that there's enough of this happening at a collective level that it's actually going to slow down public health efforts, number one. Number two, it puts their close people and their family members at risk. And so people who even want to set boundaries feel like they're at a complete loss. Like, what am I supposed to do? They're not following it, and they're gaslighting my reality. And all you can do is say, this is real. You can hold on to your boundaries with this. You're not going to change their way of thinking. So it goes back to what I was saying before. Don't personalize. Have realistic expectations. Don't engage them in their conspiratorial talk. But it is very stressful to acknowledge. It's very stressful to be in the presence of people who are denying this. But I have to say, a lot of this is coming from a place of oppositionality, antagonism, and entitlement. And honestly, don't play that game. You can't win at it. Don't engage with them, and try to keep yourself as safe and clean as protected. When they laugh at you because you have a mask on, say, you laugh at me. It's fine. I feel more comfortable like this. Own your space.
Fantastic. We have another question from one of our One Family team members who spoke earlier, Ayman. She's mentioned that she can really relate with the comments about what we can and can't control. And she's struggling in particular with trying to get through to members of family about social distancing. And that then generates a great deal of anxiety when people aren't listening, and they're kind of, like you said, displaying that oppositional behavior. And then there's that, obviously, that worry that what if something does happen because they're not listening? How can we try and relinquish some of that control that we are trying to have there?
So we can't ever control other people. God knows we want to, but we can't. Any parent out there will tell you that. So no, we cannot control other people. We can inform them. We can advise them, and we can model healthy behavior. But the one way I can guarantee you will not get someone to do what you want them to do is to demand that they do it. That's the grand irony, right? All of us are rebellious teenagers in our fashion. So part of it is to communicate it. Then the other is, though, that is going back to those two circles. What's in the circles, what you can control, everything's out. All you can do is say, these are my strong recommendations. And if they won't do it, if they won't follow that recommendation, I'm sorry, let me take some water here. If they won't follow that recommendation, that's that point where you have to engage in the radical acceptance of, I cannot control everything here. And, you can, again, if they see you, you can be in your gloves and your masks, and again, modeling that behavior. But there is a point at which we do need to accept that which we cannot change. And there can be a lot of grief because they're putting themselves in harm's way. If you don't keep shoving it down their throats, ironically, they will get it. It'll just have to be at their own pace. Now, whether that own pace is too late, that only time will tell. But we can exhaust ourselves getting very agitated about telling people that Here's a final point I want to make, though. I think one of the most important ways we can appeal to somebody else is to appeal to our feelings for them. So when it finally comes down to it, if a mother or a father or a grandmother is not listening, say, I don't know how to tell you this, so I'm just going to tell it to you this way. I love you so much. And the idea of my life without you in it is something that's unbearable to me. So I know all of this feels ridiculous, but even if there was if there was even a momentary chance you could get sick and I could lose you, it would break my heart. So how can I keep you healthy? Unless your mother or your father, your grandfather really doesn't like you, and that's a separate conversation, appealing to that, because that's what you really want. Someone you love, you don't want them to get harmed. Let them know you love them. Because sometimes that's when they say, you know what, I don't agree with this, but I'm going to put on this mask because I love my daughter.
I think that's very important in our time, because especially in certain ethnic communities, it's very difficult to communicate that, actually.
Yes, yes,
Very
yes.
good point there. We have so many questions coming in. Are you okay for us to continue? Because I think some of these are very good. So we've got one from one Shafa here, who's mentioning about what kind of advice do we have for how to manage domestic violence issues within this kind of isolating period.
So the domestic violence issues, there's sort of levels of response there. You know, obviously, number one, if you are someone who's supporting someone, you're concerned they're in a dangerous situation, I do beseech you to stay in regular touch with them, just so you can monitor their safety during the time of isolation. If a person is in a position of risk, both in the UK and in the United States, the domestic hotlines are open and they are staffed. And so you can call, and they have teams in place to help get people to services, to get out of unsafe situations. That part of the service sector did not shut down. In fact, they're already knowing they're going to have more cases. So don't be shy to do that. The challenge is, with everybody home, it can often be very difficult, especially if you have devices that are on the cloud or have shared data, like people know, they can look at your search history. You may need to be very careful about that. So it is my hope that for some people, they do have that person on the outside that they may be able to communicate with and say, help me get the help that I need. If a person is at all intersecting with healthcare settings, that this is something that they can communicate about as well. There are still ongoing support groups for survivors of domestic abuse all over the world. These are Facebook groups and all of that are very much in function more than ever, because we're seeing more and more people struggle with these issues. Some people are wondering if in a domestic abuse or family violence event, there's physical harm to someone. They're saying, oh, I shouldn't go to the emergency room. No, yes, you should. If someone's got a broken arm, who's been injured by this abuse, you absolutely should get emergency services. Remember, emergency services are working and they're prepared for the varied people who are coming in. So you can get those services. No one should be living with an injury or harm or something like that. And from that point can get the person the services they need. People who are in therapy should be getting their ongoing therapy. All of my clients are still coming in. Those who are in abusive situations, I'm continuing to link them to resources. So there's a lot of ways to be there for someone. Some people say, can I just leave? Can I just leave this relationship? Yeah, I mean, people think this is the wrong time to be leaving a relationship. I've been watching people move out of their home and move in with a sister or some other family member. It happens still. Life is still happening. But if you are indeed a supporter, be that supporter to them. With them, figure out the safest way of communication. Give them that touchstone with you each day, giving them ways to de-escalate conflict, ensuring that they have access to resources and services. The most important thing they can do is use the hotlines to call and get resources immediately. There's not much else you can do at this point.
Thank you for that. And we have quite a poignant question here from one of our sisters, who is mentioning that they lost their 6-year-old daughter about 6 months ago. She was in hospital for around 7 weeks. They also have a 20-year-old son who has Asperger's, who was helping to care for her for 12 hours a day. They're saying that he returned back to university a few months later, and now he's refusing to come home. He's in the last year of university and is approximately 200 miles away. They're really struggling to advise him to come home, and they're kind of struggling with how to manage that and help him because he seems to hate lack of control? I mean, do you have any
Mhm.
advice for them in particular?
So I think that for him is that it sounds like he stayed at school wherever it is he lives, and hopefully he's able to stay safe there wherever he is. So number one, if this family is able to establish that their son, who is 200 miles away, is he able to get access to food? Is his shelter safe? Is he able to stay safe? He may be okay. You know, it's that sense of that maybe that's where he feels his sense of control, is that by staying close to school, he is able to do what it is he needs to do. He has his routine. If he's indeed able to take care of himself, his maintaining that routine may be his sense of control, and to respect that. If there are concerns about his safety or ability to provide him for himself, then turn it into something where he is a stakeholder in his own problem solving. Say, we're running into an issue here. So, oh, okay, I see that, you know, the lease is about to be up. What are your thoughts on what might be the best way to proceed? And have him problem solve it. Again, when you square off, especially with somebody who feels out of control, and say, you need to come home, you need to do this, you have to do this, you have to do that, that pushes them to feel even more out of control, because we live in an era where can't go here, can't go there, can't do this, can't do that. People feel really out of control. So to the degree you can give someone that sense of control, allowing them to be a participant in their decision making, they may end up landing on the same place as you. But if indeed right now he's managing okay where he's at and he's safe, he's well fed and all of that, you may allow him to maintain that, because that might be the control he needs, especially under the catastrophic loss of his sibling whom he cared for. Let it be an ongoing conversation, not about you have to do it our way, but instead inquiring, how are you doing? How are you feeling? How's everything going? And in having those conversations may create more of a space where the decision-making can become more collaborative.
Absolutely. Fantastic. One of our brothers, Abdur Mia, he's asking about people who hold grudges in the family. How can you manage those scenarios? Because it's very difficult for some people to let go of grudges. Do you have any kind of tips for how to deal with them as the people responding to it, and also for the people who hold grudges, how can they let go of it? So on both sides.
Yeah. So in terms of grudges, I mean, this is funny. It's a non-pandemic question. You might be feeling their grudge more because you're stuck at home with them, but grudges are ancient. We've always held them. And so, you know, grudges are something, I always view a grudge as, I don't know if you've ever seen read The Lord of the Rings, of Gollum in the ring. It's like, this is my grudge, my precious, you're not going to take it away from me. And so the best way to get them to take it away from them is make them look away so you can snatch it. But number one is, if you're on the other side of the grudge, so it's not your grudge, someone else is holding the grudge. It goes back to the point I was making before. You know, grudge holding is, like I said, it's something that they need. It's almost starts becoming part of their identity. You've got to have realistic expectations. They're not going to let it go. So don't engage in the grudge. Don't try to talk about the grudge. Don't try to take the grudge away from them. You know, don't have that conversation, because you can't win at it. It's like, you know, just like you can't get the ring off of their hand. Like they're going to safeguard it, right? So understand that the grudge is there for them. And instead of trying to fight it, you be your best self. And you might say, how can they not see that I'm a good person? Doesn't matter. You're a good person. You don't need them to see it. You don't need an audience to that. If you're the grudge holder, it goes back to the old proverb, you know, holding a grudge is like drinking poison and hoping that it will kill somebody else. You know, it's you holding the grudge is just poisoning you, you know, and life is a gift, and it is short. So, you know, I'm convinced we take these grudges with us, you know, forward into the next realm. So I think you'd want a clean house. Like I said, it literally is drinking the poison and think it's going to kill somebody else. So, you know, for people who are holding grudges, it's very much about, you know, how do you, it's not my place to tell anyone to let go. Some people don't forgive, and I respect that. But there's not forgiving and there's holding a grudge. And I think that sometimes people feel that something that was done to them, a betrayal, was so great that they will never be able to get past it. That's okay. To which I'd say, then don't keep getting into antagonistic interactions with this person. If you're never going to let go of it, then it's done. Like, then this relationship may honestly be done, and give yourself permission for that, because then it can't go back and be fixed. Sometimes time does, sometimes time doesn't. But this idea that you're going to keep parading your grudge down, like keep talking about your betrayal over and over and over again, you can't unring a bell. You know, it's happened. And so how you choose to deal with it, that's the only thing you can control, is how you choose to deal with it. For the people on the other side of the grudge, just don't engage over it. Engage in acceptance that this is what they're holding on to, and then figure out some other way to talk with them, or not at all. Until they're ready to let it down, you're not going to be the one to pull it out of them. Be your best self.
Fantastic. One of our sisters here is mentioning that there's going to be she thinks, a lot of post-traumatic stress disorder within society as a whole, but also healthcare workers. And is there any advice that we can perhaps have for this?
That's a brilliant question, because she's absolutely right. We're already seeing the front lines of this. Now, what is interesting is that there was a paper that came out of China, because they're already starting to publish some of the research that they've conducted with healthcare providers there. The thing that was reassuring about the Chinese manuscript was that the majority of healthcare workers really were only showing mild symptoms, psychiatric symptoms, a couple of months out. But the problem was, those who were showing symptoms, they were pretty severe. So the post-traumatic symptomatology, the unmanageable loss, the lack of protective equipment, the unrelenting demands, et cetera, that was for many people, they're having different reactions. What you have to remember is that trauma is an interesting space. Not everyone reacts to it similarly. And the ways we react to trauma have a lot to do with our own pre-existing history of trauma, our histories of anxiety, depression, and other mental health issues, as well as other issues around us, like our supports that we have, places we can turn to, like therapy and friends and close family members and all of that. So where we're going to see is a wide distribution, not only in the NHS, but all over the world, of how healthcare workers respond to this. And a lot of it's going to be how quickly they're able to access spaces and services, their colleagues, to talk about this, because this is very real and it's happening. It's those who are in settings where they feel unsupported, where they could feel ongoing sense of sort of emotional abuse, and those who may also have relationships outside of the workplace that are emotionally abusive or invalidating. They will be at greater risk for post-traumatic stress. So we're going to see a lot of differentiation here, and I think it's very incumbent on the NHS, on healthcare providers, on hospitals and clinics to provide right there in lifetime mental health resources, breaks, and supports, not just now in the heat of the moment, but ongoing. I think that the NHS needs to rethink their strategy and pay their healthcare providers more to show them the respect that they deserve for the hard work that they do in that really, overburdened system. The same thing in the United States is that kind of respect will go a long way. But I also want to put one more note on this, because we're at a time when we keep talking about post-traumatic stress and trauma. We forget about one very important piece of the puzzle, and that's post-traumatic growth. Many people who go through trauma grow significantly from the experience. A lot of people out there, and I think the healthcare providers are going to be leading this cause, are going to say, you know what? I am now going to become an advocate for better healthcare systems. I am actually going to go back on maybe a nursing. I'm going to go to med school. I'm going to go back and I'm going to get a certificate so I can do more leadership in healthcare. People are just going to feel stronger. They're going to feel like, wow, this was my meaning and purpose, to help people, and I really did it. Post-traumatic growth is something we don't talk about enough, and it's almost like it all has to be doom and gloom. And there's a lot of amazing things that are come out of this too. But the only way we can cultivate that growth is by providing people the supports, the safe spaces, and giving people permission to share their grief, their sadness, their fears, and their uncertainties. And the employers have to support them. And treating employees badly, healthcare employees badly, by not giving them what they need to do their job, that's a fast track to post-traumatic stress. And this is where the people making the decisions need to step up and start behaving in ways that everyone needs them to behave. And I don't trust our politicians anywhere in the world. Talk about narcissism, that'll be another conversation, but they definitely need to step up and take care of the heroes amongst us.
And that's a fantastic point there. I think a lot of us haven't really thought of it like that, the post-traumatic growth. And I think we can all come out from this pandemic with some growth. I think we'll just take one more, because we've had so many questions.
You must all be tired. I'm so sorry, you must all be very tired.
So the last one is from Zainab, and she's mentioning that she was recently blessed with a baby after trauma from losing a parent and emotional abuse from her family. She says she's afraid that her bitterness and insecurities would affect her baby. And so she's asking, how can I let go of resentment and stay positive or not get triggered. And, you know, she seems quite motivated. She's saying quarantine is a time where she wants to rewire and really help with that. Is there any advice you can give her?
Yes, I would say for Zainab, first of all, congratulations. A baby is always a blessing. And if ever there's a place to find meaning and purpose, it's in our children, where many times we say, I don't want them to get bogged down in the resentments and the betrayals of the generations before. I want them to start anew. So in many ways, that those things I was talking about, meaning and purpose, giving your child that freer passage, allowing them to be more authentic and loving them unconditionally. This is actually a very healing opportunity for her. But I would say with the other issues, where the reason mindfulness becomes so powerful is if we're only staying in the moment, we're not giving our mind over to the losses and betrayals of the past, or what are we going to say to those people in the future. And the beauty of being with a baby is I can think of nothing more mindful and meditative and beautiful than staring at a child's face while you feed them or sing to them and you're looking right at them. That's mindfulness at the highest level of the mountain, right? And so that's where I think that that for her to practice that mindfulness presence with her child is going to be a very, very big one. I would also say, though, again, I know it seems like an odd time to start therapy, but it's not, to look into therapy, especially therapy around trauma, because sometimes doing that deeper dive into one's traumatic history and integrating that and understanding you're not defined by what happened to you, and to understand that we can all derive some meaning from our suffering, that our suffering does not ever happen in vain. There are lessons there, that it makes us who we are, that it is part of our journey. And that then she can understand that in many ways, the mother she is to become is informed by that struggle. And it's the things we want to protect our children from and do better for them. It's like, it almost becomes letting go of some of this, some of the resentment is a gift to her child, even more than it's a gift to herself. But I really do think doing grief work, doing trauma work, getting some therapeutic intervention, and using this time for mindful awareness of her own child is going to be absolutely critical. But also going back to that self-compassion, I'd say to Zainab, please consider that practice of self-kindness, common humanity, and mindfulness. Those three things together, that if you can find compassion for yourself, while love of others is a beautiful experience, it really only becomes an enhancement to that compassion and that love we have for ourselves. And for that divinity that we carry within ourselves, that becomes critical.
Fantastic. On that note, I think we'll wrap it up there.
Thank you.
Thank you so much.
It was my pleasure. Thank you.
We hope to have some follow-ups in the future, so we'd love to.
Sounds great.
Home.
Yeah. And someday we'll do it live. My daughter lives in the UK, so she'll come back hopefully in the fall, and I will come and we'll meet in person. I still hold to that future that we all get to meet. Yes.
Oh, fantastic. Thank you so much again.
Thank you. Yes, I hope so. Take care. Bye-bye now.